Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Going to talk to you about the medication Tramadol. Specifically, the topics we'll cover in this video is what is Tramadol, how does the medication Tramadol work, the typical uses, common dosage, some of the most common side effects, other side effects and warnings. Also, we'll talk about potential withdrawal symptoms and how to mitigate that. As with all my videos, this is informational purposes only, and it does not serve as a substitute for the consultation, diagnosis, and or medical treatment of a qualified physician or healthcare provider. Okay, to start off, what is Tramadol? It's a prescription pain reliever, or often referred to as analgesic. In the US, it's sold under the brand name Ultram, or there's an ER, extended release capsule Conzip. And in the United States, it is a controlled substance because there is a potential for abuse, addiction, and misuse. So how does Tramadol work? How does the medication work? It's a synthetic codeine analog. So it was derived as a synthetic codeine analog. It binds to something known as the mu opioid receptor. So that's a receptor in the body that gives us that analgesic effect, the pain relieving effect. That's what we're looking for. Unfortunately, when you bind to that, you can also get some respiratory depression. So there's a potential for shallow breathing, or in the worst case scenario, you could stop breathing altogether. Pupil contraction or meiosis, constipation, and euphoria. Euphoria, unfortunately, can lead to some of the abuse and misuse of the medication. It is also a weak, what is known as an SNRI, or serotonin norepinephrine reuptake inhibitor. And there are also other medications, antidepressants and such, that have a similar effect, and that can increase the risk of interactions and side effects when you're using both those with the Tramadol. Uses, the most common use is pain management. We see it used for acute pain and chronic pain. When used short term for pain management, most people do really well, especially if they taper their dose as the pain is decreasing. Usually not many issues. Off-label, it's been studied for premature ejaculation and restless leg syndrome. Very small amount that's used for those, but it has been studied for those other uses as well. So what about dosage? Well, the maximum dosage with the immediate release, that's the most commonly one we see used in the United States, the 50 milligram tablets. 400 milligrams is considered the max daily dose. Ideally, we're going to be below that. Extended release, literature suggests around 300 milligrams a day is the maximum dose. If there's some poor kidney function, where that max dose is reduced down to 200 milligrams a day. Oftentimes, we see the starting dose 50 to 100. So the 50 milligram tablets, that's 1 or 2 every 4 to 6 hours. Again, we only want to use it for what is needed for the pain. When you go over and you take more than what you need, that's where you can become dependent on it, or addiction potential is there. Some of the most common side effects, we can see constipation in up to half of people. That is dose dependent. So the lower the dose, the less likely the risk. But oftentimes people need to take a stool softener or a stimulant laxative with this medication to prevent that. Nausea and vomiting can occur up to 40%. Many people benefit taking this medicine with food to reduce that chance. Drowsiness can occur in 3 out of 10. We do have to be cautious about that. Very cautious if you need to do work or drive that requires alertness. You have to be careful there. Headache can occur in 12 to 32%. Some other side effects we can see are sweating, swelling, itching, difficulty breathing. We touched on that one a little bit. It can cause some dry mouth. It can cause depression or worsen depression. Some flushing, anxiety, confusion, restlessness, hot flashes, and other side effects can occur. Warnings. Addiction, we've kind of touched on this. Addiction, abuse, and misuse potential is there. Respiratory depression can occur. We talked about that mu opioid receptor, and that can lead to respiratory issues. There is a medication called naloxone, which can reverse the action on the opioid receptor, and it can potentially save your life if you're on this and other medications that put you at high risk of an accidental overdose. That is something you want to talk to your doctor or pharmacist about. To have on hand so you or a loved one could administer that in a situation where you're having some of those severe breathing problems. It could save your life. Can be fatal to children, so we need to absolutely make sure it is kept out of reach of children. One tablet is enough to be fatal to young children, so it's very important we keep this medicine, as with all medicines, out of reach of children. Pregnancy, it is not recommended. If taken during pregnancy, the child can be born dependent on this medication, and then when they're born, they'll go through withdrawal symptoms. So for that reason, it is typically not going to be used during pregnancy. We need to use extreme caution with benzodiazepines. So we're talking things like Xanax, Valium, because those can also cause issues breathing, and you take it with another medication on top of that, and it can get to the level where we worry about an accidental overdose or death. And any other medicine that cause depression of the central nervous system, we need to be extremely cautious about those. Can be used together, but need to be mindful and aware of the potential problems. And drug interactions, it is best that you get your medications from the same pharmacy so they can screen them for drug interactions. It's important that all of your healthcare providers be aware of all the medicines you're taking, again, so they can watch for potential interactions. Also, we can see a drop in blood pressure, or what's known as hypotension. We have to be careful because that could increase your risk of falling. If you stand up and you get lightheaded, you could fall over, and a fracture potential is there. Seizure potential, it is a pretty low risk, but there is a potential for seizures to occur. Other warnings can include suicide risk, generally with those already with some psychiatric issues or already some suicide potential, so we need to use real cautiously in that group. Serotonin syndrome, usually with people who are on antidepressants, that can be a serious condition where you have a sudden change. You can have seizures, you can be excessive sweating, tremors. It's a situation where you'd want to seek medical attention immediately. It can sometimes cause low blood sugar, so we need to be cautious in diabetics. Again, drug interactions we've already spoken about, but that is very important that your pharmacist knows and all your healthcare provider knows your other medications. And then we have to be cautious in sleep apnea, or people who have issues breathing during sleeping hours. Again, that goes back to that mu opioid receptor that can inhibit respiration or breathing. So withdrawal. Typically, withdrawal can occur, and the dose should be tapered. Ideally, when we're using this acutely for pain, your pain improves, your dose should go down. There is no standard taper. It's going to depend how long you've been on the medicine, what your dose is. Some of the symptoms that can occur with rapid withdrawal can be restlessness, anxiety, difficulty sleeping, some sweating. Of course, your pain could return, nausea and stomach issues, diarrhea and runny nose. Those all can occur when you're withdrawing from this medication. So kind of just to recap some of the important nuggets here, we always, with these controlled substances, we always want to use the lowest dose for the shortest duration as possible. That's just going to reduce the potential that we're going to become dependent on this medication, and because then it's really hard to get off of once you become dependent on this medication. Taper, usually the dose needs to be tapered. As the pain is decreasing, the dose should decrease. Or if you've been on this medication long term and you're looking to get off of it, the dose will need to be tapered. Caution with other medications, again, so we can screen for drug interactions. And this, you don't want to use alcohol with this medication ever. Again, the respiratory issue, this medication and alcohol, you could stop breathing. I do appreciate you watching this video. I would like it if you'd like the video as well as subscribe to my channel, and go ahead and ask questions below in the comments. I will do my best to answer them for you. Thank you for watching.